here chasing a feeling. Up high, down low, we go from the floor to the ceiling. We fly, we fall, we get back up and try again. Some do, some don't, some will, some won't. I wanna feel just a little, just a little, just a little. Put my heart in the middle, in the middle, in the middle. Wanna live just a little, just a little, just a little. Wanna feel just a little, just a little, little bit more, little bit more. Big heart, big plans, big dreams, and we ain't even sleeping. Who can? We can. We dive right into the deep end. You win, you lose. You get back up and try again. Some do, some don't. Some will, some won't. I wanna feel just a little, just a little, just a little. Put my heart in the middle, in the middle, in the middle. Wanna live just a little, just a little, just a little. Wanna feel just a little, just a little, little bit more, little bit more. I want it all, please don't judge me. I want some love and some money. I wanna be at the party, yeah, that's me at the party. Wanna dance with somebody. I wanna feel just a little, just a little, just a little. Put my heart in the middle, in the middle, in the middle. Wanna live just a little, just a little, just a little. Wanna feel just a little, just a little, little bit more, little bit more, a little bit more, little bit more. It comes and goes. We're out here chasing a feeling. Up high, down low. We go from the floor to the ceiling. We fly, we fall. We get back up and try again. Some do, some don't. Some will, some won't. I wanna feel just a little, just a little, just a little. Put my heart in the middle, in the middle, in the middle. Wanna live just a little, just a little, just a little. Wanna feel just a little, just a little, little bit more, little bit more. Big heart, big plans, big dreams, and we ain't even sleeping. Who can? We can. We dive right into the deep end. You win, you lose. You get back up and try again. Some do, some don't. Some will, some won't. I wanna feel just a little, just a little, just a little. Put my heart in the middle, in the middle, in the middle. Wanna live just a little, just a little, just a little. Wanna feel just a little, just a little, little bit more, little bit more. I want it all, please don't judge me. I I want some love and some money. I wanna be at the party, yeah, that's me at the party. Wanna dance with somebody. I wanna feel just a little, just a little, just a little. Put my heart in the middle, in the middle, in the middle. Wanna live just a little, just a little, just a little. Wanna feel just a little, just a little, little bit more, little bit more, a little bit more. Little bit more.
The Delaware AHA Heart Walk is here again, and we're ready for it. We need it now more than ever before. Heart disease remains the #1 killer in America. And it's not the right time for us to stop paying attention to those things that we know can make a big difference. Making good choices, eating right, exercising, and very importantly, remaining in touch with your health care providers so that you get the ongoing care that you need. And of course, let's not forget to get vaccinated. The vaccines are safe. The vaccines are effective. And frankly, they're the only way we're going to get this virus behind us. The American Heart Association has partnered up with Christianity Care in achieving the goals of better health for our community. We look forward to it. The Delaware AHA.
Good morning. Welcome. I'm Dave Morris, Executive Director for the American Heart and Stroke Association here in Delaware. I want to express my tremendous appreciation to all of you for joining us this morning. We are thrilled you are attending our Heart Walk Rally Day event with us today. The mission of the American Heart and Stroke Association is to be a relentless force for a world of longer, healthier lives. The AHA funds innovative research, fights for stronger public health policies, and provides life-saving tools and educational information to prevent and treat cardiovascular disease and stroke. Cardiovascular disease is the nation's and Delaware's #1 cause of death, accounting for more deaths than all forms of cancer combined. Stroke is the #5 cause of death in the US and the leading cause of long-term disability. Unfortunately, stroke is the #4 cause of death here in Delaware. Today, we are coming together for a common purpose to fight heart disease and stroke. Today is our Heart Walk Rally Day. Our Rally Day is a day for all of us to come together in a focused effort to mobilize our teams and accelerate fundraising for the Heart Walk. Plus, there are fun awards and prizes you might receive around registrations and fundraising as a result of your efforts today. We hope that you will join us in the chat box during today's event. To do so, just click on the chat icon on the bottom of your Zoom, and then select all attendees and panelists so everyone can engage with you during today's event. So let's give that a try. Everybody just jump into that chat box and say hi to everybody. Hi, Caitlin, great to see you. Lauren, Cheryl, hey, Kathy, great to see you. Brenda, welcome. Tracy, Lori, oh my goodness, I can't even keep up with all you guys. Judy, Michelle, hi, Michelle, it's great to see you. Hey, Phil, will I be serving coffee? No, you're on your own on that one today, Phil. I'll get you next time, okay? It's great to see so many passionate lifesavers here with us today. Now let's hear from our extraordinary 2021 Wilmington Heart Walk Chair, Randy Stone, President, DuPont Mobility and Materials. Randy?
Yeah, thanks, David. It's so great to be with everyone today. Hey, I am so proud to serve as the chair of the Wilmington Heart Walk this year. And really on behalf of everyone at DuPont, I just want to say how honored I am that we can demonstrate the company's leadership in this fight against heart disease and stroke. Along with Dr. David Tam in Southern Delaware, we are working to advance the mission of the American Heart Association to reduce deaths from heart disease and stroke in Delaware as well as improve the future health of this great state. The American Heart and Stroke Association is working tirelessly to advance cardiovascular health for all, including identifying and removing barriers to healthcare access and improving quality by 2024. Your participation in our Heart Walk will make a positive impact in terms of advancing transformational research and supporting local community programs with a focus on hypertension control, CPR education, stroke prevention, and heart healthy living. With your support, the AHA's community impact work will raise awareness, educate the community, and inspire all of us to make the small changes that can make a significant difference in living a longer, healthier life. Everyone joining today is critical to the mission of the American Heart Association and in making the Heart Walk a phenomenal success. Through your support of the Heart Walk, you're joining with us to fight cardiovascular disease and stroke and to truly save lives. The Heart Walk represents an inspiring way to unite our community. It's also a meaningful way to honor and remember loved ones lost to cardiovascular disease and stroke. And it's a powerful way to celebrate and recognize our incredible survivors. I am so deeply grateful for your support, and I so much appreciate being part of the AHA team. Thanks, David.
Thank you so much, Randy. We appreciate that you are such a great champion for our work here in Delaware. Thanks, Randy. And now it is my distinct pleasure to introduce you to one of our greatest champions, Kayla DiGiovanni. Wait until you hear her story. Kayla is going to share her profoundly touching heart story with all of us. Kayla?
Hello, my name is Kayla DiGiovanni, and my story is one that needs to be heard. When I was 19 years old, while jogging on a treadmill at my gym, I went into sudden cardiac arrest and dropped instantly. Luckily, there were 2 other girls in the gym with me at the time. The 2 of them immediately called 911. When the paramedics arrived, they conducted CPR for 45 minutes, and I was later shocked 6 times before I was consistently responsive. Once I was hospitalized, I was diagnosed with hypertrophic cardiomyopathy, otherwise known as HCM. Soon after my diagnosis, the decision was made that I needed an ICD, or an implantable cardioverter defibrillator, for the rest of my life. I then underwent surgery to get the ICD inserted into my left side. This defibrillator will shock my heart back into rhythm if I ever go into cardiac arrest again. During my resuscitation process, the lack of oxygen to my brain caused me to have an anoxic brain injury. This brain injury caused me to temporarily lose my memory and all of my fine motor skills. After many months of inpatient and outpatient physical, occupational, and speech therapy, I was able to return and continue studying at my university. CPR saved my life, and I am forever grateful for the EMTs who performed it on me. I cannot stress enough how important the training for CPR is. By being CPR certified, you could save a loved one's life. Without advancements made possible by the American Heart Association research, I would not have had the proper medical procedures to save my life. Now I have made it my mission to give back to the American Heart Association. Now is the time to educate yourself on heart health. Visit heart.org/Delaware today.
Oh my goodness, what a powerful story. Kayla, thank you so much for sharing with us today. You are truly a compelling force, and we are really grateful for you for sharing your inspiring story. Now I'm honored to introduce you to the highly regarded medical director of the Center for Heart and Vascular Health at Christiana Care, Dr. Kirk Garrett. Dr. Garrett joined Christiana Care in 2015, and his impressive background includes 17 years at the acclaimed Mayo Clinic in Rochester, Minnesota. Dr. Garrett was a member, this is amazing, of the team of physicians who first performed minimally invasive heart procedures there and at the Mayo Clinic, and we are so lucky to have him here in Delaware. We are thrilled to have Dr. Garrett on our Wilmington Heart Walk executive leadership team, and we are deeply grateful for his outstanding leadership. Dr. Garrett will now present on the impact of the COVID-19 variants. Dr. Garrett?
Thanks, David, and it's really great to be here with everybody this morning. A shame we can't be all in a room together, but soon enough. And although the day is really about getting launched around our Heart Walk and all the impact we're going to have on heart and vascular disease, in this moment, we're really concerned about COVID-19. So David's asked me to make a few comments about that. I promise I'll bring it back to the heart and vascular system at the end. We can go to the next slide, please. I wanted to make a few comments about variants, since that really sort of has the attention right in the moment. And what is it about variants that worries us so much? Well, it turns out that every time a cell is infected with a virus, the virus goes about manufacturing many thousands of copies of itself. And that process can have errors. And as a result, mutations can occur. Now, most of those mutations make the virus weaker or even make the virus non-functional, but some can make the virus more powerful. And of the several things that can happen there, the two that we really worry about most are increases in transmissibility, the ease of infection occurring, and the increase in virulence. Now, if you go next, please. The World Health Organization and the CDC track variants, and they categorize them according to how worrisome they think those variants may be. They think of them as being variants of interest that they just keep an eye on, those that are of concern, and we develop policies to address, and then variants of very high concern that have create a special threat to the public health. Happily, right now, we have no variants of very high concern, but we do have variants of concern, including, of course, the Delta virus. If you can go to the next slide, please. Why is the Delta virus so important? Well, the original SARS-CoV-2 strain had what we call an R0, or a transmissibility factor, of about 2.5. That is, for every person who's infected in a completely vulnerable population, we would expect another 2.5 people to catch the infection. The Delta variant is much more transmissible. It has an R0 of somewhere between 6 and 8. Now, if you can go to the next slide. What that means is that after 10 replication cycles with that original variant, that one index case would be expected to create just under 10,000 additional cases. That's a lot. Next slide. But with the Delta variant, with an R0 of 6, that individual would create more than 60 million new cases. And if the R0 is 8, it's over 1 billion. So clearly, this increased transmissibility issue is of great concern. Next slide, please. In fact, we have seen in our community the spread of infections followed by hospitalizations and sadly deaths that track the evolution and emergence of this Delta variant. You see the peaks of cases these are throughout Delaware. The initial outbreak, we had a favorable period then going into last summer when lockdown efforts and so forth were having an impact. Around the holidays, still primarily that original SARS-CoV-2 virus was in the community, but people were gathering once again, letting their guard down a little bit. And we saw a huge surge in new cases. That tamped down during the winter, but round about March and April, that's when the Delta variant made its way into the United States. It took a couple of months for it to really get traction, and now it's by far the dominant germ causing COVID-19 illness. And as you can see, we're back in the midst of another surge. Go next, please. Now, of course, before vaccines were available, 100% of infections were among unvaccinated people. Although we have good layers of protection evident now from the vaccine being distributed in the United States, it remains true that this problem of COVID-19 illness remains still a problem of the unvaccinated. Currently, 95% of new cases, 96% of hospitalizations, and 97% of the deaths related to COVID-19 are among unvaccinated individuals. That's really quite sad because these are preventable events. Go next. Here in Delaware, we're actually doing pretty well with the vaccine. If you look at the number of Delawareans 18 years or older who have had at least one shot, it's more than 77% of people, which is terrific. Go next. But of course, we still have opportunities in our state. There are equity gaps here. For example, in some of the more affluent, better educated parts of our state, the vaccination rates are extremely high. In those areas where there's a greater prevalence of poverty conditions, lower levels of education, lower levels of health literacy, and frankly, lower levels of trust in the vaccine and the healthcare system broadly, we continue to struggle. Our lowest vaccination rate is less than 40% in the northeastern Wilmington area. So we still have great opportunity here in Delaware. Go next. Nonetheless, despite our challenges here, we are doing better than the nation as a whole. As you can see from this heat map with darker colors indicating higher event rates, those counties which historically have had lower vaccination rates are dominant in new case incidents. You can see the new cases are clustered largely in the south, parts of the mountain states, and pockets of the non-coastal west. Go next, please. And those new cases are followed by new hospitalizations. And as you can imagine, because this new Delta variant, which is now dominant, is so transmissible, it is quickly overwhelming health systems. Go next. You've probably heard in the news, places like Idaho and other states now are having to operate on crisis mode, meaning they allocate resources, they triage patients and make hard decisions about who will get the ventilators and who will not, simply because they have exhausted their resources. This is a terrible situation that can be prevented with a broader vaccine portfolio. Go next. I do want to underscore, though, the positive aspect of getting vaccinated. Paper just published recently noted that since the introduction of vaccines in the United States, it's estimated that about 140,000 deaths have been avoided. Go next. Look at this curve. You can see the yellow or gold line is the projected death rate through May. You can see that the predicted death rate in teal actually tracked perfectly with the actual death rate. That is death rates that were predicted to be mitigated, deaths that were intended to be mitigated through the introduction of vaccines, and you can see the model fit perfectly the prediction. Go next. And the financial impact of this is very real. Everyone that doesn't die of COVID is another productive member that remains in our community and provides for family. The estimated financial impact of the vaccine program so far is between $600 billion and $1.4 trillion to the American economy. So from just that aspect alone, vaccines have been a terrific investment. Go next. We now know we have mandates. This is a controversial topic, I recognize, but I do think that there is room for a conversation about them. I'm actually proud of the fact that Janice Nevin, Dr. Nevin, president of my healthcare organization, mandated that members of Christianity Care must be vaccinated. That mandate was announced at the end of July, and just this week was the deadline. I'm pleased to report that the number of people who elected to leave Christianity Care because they could not or would not conform with the mandate was extremely small, extremely small. We have, I think, embraced the reality that these vaccines are safe and effective and very important for the care of our community. Now we have President Biden's mandate, which could have an even broader impact. 100 million Americans may be vaccinated anew as a consequence. So I think these are favorable from a public health perspective. Go next. The booster issue is still very much in evolution. You've heard recently that in addition to those with weakened immune systems, folks over 65, perhaps like others, are recommended to receive the booster now. There's still a lot of this story yet to unfold, but I do anticipate that boosters will become a part of our reality. I wouldn't be surprised if going forward, we get annual COVID shots, just like we get annual flu shots, maybe even combined. And for those concerned, as I am, about the impact of providing more vaccinations in the United States while the rest of the world goes without, it's worth knowing that of the vaccines that are available in the United States, current production capacity is estimated at 1.5 billion doses per month. So I don't think this is a situation in which we have to choose between vaccinating our population with boosters as opposed to providing vaccinations to others. I think it is possible to do both in parallel. Go next. All right, I promised to bring it back to the heart and vascular system at the end. We all know about the long haul COVID business, and we've heard about the terrible acute problems that can happen in the heart and vascular system with a COVID-19 infection. One of the really interesting new discoveries to me is that of those things that happen when people get COVID-19 infection, of all the different problems they can develop acutely and in the long haul picture with late complications, this word collage represents sort of the types of problems we're seeing and the frequency with which they're being seen, the size of the font denoting how common they are. If you go next, please. Isn't it incredible that the most common problem is the onset of new hypertension? And I don't have to tell this group how important that will be on a public health perspective and in terms of individual welfare. Living in a state where stroke kills more Americans than on average in other states, and hypertension is behind most of those strokes, this is really a great concern. So I'll leave you with that. Go to the last slide, please. I do think that we have been on a very long journey. We're all exhausted. There is light at the tunnel, but it's not dead ahead. We've still got curves to negotiate. We've got to wind through some things, but we will get there. And I'm happy to be partnered with an agency like Delaware American Heart Association to get this work done, not forgetting that at the end of the day, heart and vascular disease is really the thing that most threatens Americans. We can't take our eye off that ball. Thanks, David, for letting me be with you today. David, I think you're muted.
It was going to happen, wasn't it, Dr. Garrett? It was going to happen once. Thank you so much. And thanks for telling me about being muted. Thank you, Dr. Garrett. That was really great, insightful information. And, you know, especially on the variants and the booster shots and really how it's affecting lives here in Delaware. I thought that, you know, while some of that was sort of some scary information, I think it's good for us to know. And also it's really great for us to see sort of how well Delaware is doing in certain aspects. And I think that's really fantastic. The 77% thing really jumped out at me. It was wonderful. Now, I want to take a moment to recognize and acknowledge the significant support we've received from our Wilmington Heart Walk sponsors. Our very special thanks to the following companies who are helping us save lives right here in our local community. I would also like to give a very special thank you to Christiana Care for being our title sponsor of today's Rally Day event. Thank you so much to everyone at Christiana Care. We really couldn't have done this without everyone's support. Now, a very special thank you to our Southern Delaware Heart Walk sponsors for their remarkable support. We are deeply grateful to the corporate community for aligning with our mission and to help us save lives. And even Dr. Garrett mentioned hypertension control, and that is a huge focus for us here in Delaware, and to save many lives for many years to come, and it's thanks to folks like these. It is now my privilege to introduce you to the President and CEO of BB Healthcare, Dr. David Tam. Dr. Tam is a distinguished and accomplished healthcare executive and a retired officer in the U.S. Navy. He completed his pediatrics residency at the U.S. Naval Hospital in Oakland, California, and a pediatric neurology fellowship at the Medical College of Virginia. In March, Dr. Tam celebrated his one-year anniversary at BB, and his strategic leadership has made an incredible difference in Delaware. We are honored to have Dr. Tam as our Southern Delaware Heart Walk Chair, and we are grateful for his exceptional leadership. Dr. Tam will now briefly update us on the latest advancements in stroke care. Dr. Tam?
Thanks, David. I hope you can hear me. I had a little bit of a technical problem getting on, but I think I think everything is good. So my name is David Tam. I'm the president and CEO of BB Healthcare, and I'm a pediatric neurologist by training. And although many people don't think that kids get strokes, actually a lot of them do. And it's really important for me to be on this with this group to support the American Heart Association, because the Heart Association is also the Stroke Association, and AHA and ASA work very hard to support and fund research for treatment and prevention of strokes. And many times that work is then, like in a lot of healthcare, carried on into how that new advance in treatment or in preventive care ends up being available and usable in the treatment of pediatric strokes. So it's my pleasure today to talk briefly about updates in stroke management. And so, please know that that is my passion, and that's why I'm here. That's why I've got our organization working heart care as well as stroke care. Stroke is rapidly becoming one of the serious problems. And as Dr. Garrett just talked about, we're seeing a higher incidence of stroke, predominantly due to vascular issues in patients, coming out of COVID-19. And so it's really something that's exciting. Next slide, please. So I just want to give you a little bit of a baseline about stroke, because we talk a lot about heart disease, but in stroke, there's almost 1 million people, 800,000 people in the US who experience a stroke every single year. Now, there are two kinds of stroke. There's ischemic and also vascular, but ischemic is predominantly 700,000 of them are strokes that occur because a part of the brain doesn't get blood. They get ischemia. And a lot of that can be due to mostly clots that occur in large blood vessels. Of that, you need to know that almost 200,000 of them are recurrent. In other words, people have strokes over and over and over again. And one of the reasons why that happens is not just because of an underlying medical condition, but because unfortunately in today's society, people still don't do a lot to help reduce the risk factors that continue to cause strokes. So if you think about that, a large number of strokes, the majority of strokes can actually be prevented. And that's both ischemic first-time strokes or continued recurrent strokes with the prevention of 5 basic factors of management. 1, Dr. Garrett talked about blood pressure. Managing your blood pressure is still the best way to prevent you from getting a stroke. 2, managing your diet. 3, physical inactivity. In other words, we're not just talking about exercise and all that. We're also talking about just the number of times you stand a day, versus sitting in your chair. There's some new data that's coming out about whether or not there's higher risks of heart attack and stroke because people are spending all their time in a video conference like today, for 8-9 hours at a time, and not necessarily getting up on a regular basis to move from meeting room to meeting room or things like that. But physical inactivity is a huge risk factor. Smoking continues to be a huge risk factor. And that's so important because the fact of the matter is people still are smoking. Young people are still picking up smoking as a habit. We think about lung cancer as a big issue, but smoking is a #1 issue related to stroke. And then something we call abdominal obesity, not just obesity, but abdominal obesity, where people have abnormal BMIs, and that obesity, the fat is usually stored around their abdominal areas. And that's really important because it's beginning to identify how that has to do with certain diabetic factors, certain pancreas factors that may link you to a higher risk of stroke. But those 5 factors are critical. And so next slide, please. It's really important when we talk about stroke in 2021 and updates and management, that there's all kinds of exciting things we'll talk about in a minute, that still prevention is still the best method for preventing initial and recurrent stroke. And that's one of the reasons why, the Heart Association and the Stroke Association are doing so much in terms of things like building and supporting those farms and kids' schools so that kids can learn about how to grow healthy vegetables and manage their diet and things like that. So moving from prevention, next slide, are some of the really exciting things that are going on in new and advancing treatments for stroke. I'll talk about just a few things because so much is going on and a lot of it is being sponsored and supported in terms of research by AHA and the Stroke Association. One of them is actually the use of artificial intelligence. Up to now, the majority of the time, people come in, they have a stroke, and they get something called a CT scan, a computed tomography, or a CAT scan, as you may have known. Now, the CAT scan helps identify if a part of the brain has been injured or damaged. What is being used now is the use of artificial intelligence, where some of these CT scans are then fed into large computers at research facilities, and these large computers use artificial intelligence to really identify where the damage to the brain is highest with that stroke, because you don't always get to see where the damage is going to be with just seeing a blood clot or seeing that there's an area of the brain that's been damaged on CAT scan. So the artificial intelligence actually allows the doctors to then fine-tune vascular treatments, where they can go in, and I'll talk about that in a minute, and identify where the clots are in the blood vessels and can maximally improve their targeting capacity to get the blood clot and improve the therapies so that people have the least amount of damage over the next couple of days as that stroke truly identifies itself. That's really exciting. Of course, it's a big places, but more and more as health systems across the country, including people like us at BB Healthcare here in Sussex County, have access to large computer networks, we're going to be able to see a lot of this going on. Next slide, please. Another interesting and advancing treatment for stroke is new alternative thrombolytic or clot busting drugs that are being researched. And so there are two ways basically to treat those ischemic strokes, right? Those strokes that are caused by a blood clot that blocks a blood vessel. It's like damming a river and the blood doesn't go to parts of the brain. One is, of course, using clot busting drugs, thrombolytic drugs that you inject into the body and it goes to that blood vessel, goes into that clot and can help dissolve that clot. We usually use something called alteplase, which has been around for a long time, but there are new clot busting drugs like tenecteplase that really allow us to do a better job, because what it does is it targets the ability to dissolve big clots. So if you think about blood vessels like a river, like you see in that picture, you start with large rivers, and then eventually the blood vessels become small tributaries, and then blood clots can form in small blood vessels or sometimes in the larger blood vessels like the big river. Traditionally, the alteplase medication usually has been working well to treat the blood clots or dissolve the blood clots in smaller rivers. But these new medicines really do well in terms of breaking up the blood clots in the big rivers. And that's really huge, because if you can do that, you can really continue to open up blood flow to large parts of the brain that may be damaged. And that's very exciting. If you look at that, reperfusion of greater than 50% has been identified because of the ability to use these new drugs. And there are more new drugs coming online and on, every day that we're really excited about in healthcare. Next slide, please. The other way of treating clots is to actually go in and use a catheter and go in that river, go in that blood vessel, and physically or mechanically remove that clot. And we're doing much more in terms of endovascular thrombectomies and treating, not once again, those smaller blood vessels, but really reaching in and getting the big clots that impact larger vessels. This is something that more and more is going on. And these are catheters that aren't just mechanical, they're just not like little arms. In this case, what you're looking at is a mesh stent retriever that is almost like a mesh, like almost a fabric that is also got some chemicals on them, and it helps to go in and find a large clot and actually help that clot be absorbed by the catheter. This is actually something like, this is actually not my field, but it's something that Dr. Garrett does in his world, especially with respect to doing on the things in the heart. But this is something that's also available in the brain, and we're doing a lot more work in this area. Next slide, please. Now, here's something I think that's really exciting and ties back in with what Dr. Garrett was talking about COVID-19. You know, those of us in running health systems have really seen an improved increase in something called telemedicine, you know, because people were afraid to come to the hospital or go to see their doctor because of COVID. We stepped up the use of our telemedicine. You might have had that, where you see a doctor online, on camera, and actually get them to assess you, evaluate you, and then order a prescription with your pharmacy someplace else. Now, we're looking at that in terms of stroke treatment. If you think about this, the earlier the diagnosis, the earlier people think that they're having some ischemic symptoms, you know, that where that clot is starting to block the blood vessel, the better the opportunity to treat that. And so when people are thinking, you know, I'm having a little tingling in my hand, or there's a little bit of numbness, right? They can now get online and speak to a physician and actually show things, do an exam on a screen, touch your toes, touch your fingers. Can you move? Can you touch your fingers to your nose? You know, left side versus right side. Do you have some facial weakness? How's your speech? Are you slurring your speech in any way? And that can help a physician or a clinician talk to patients and identify or diagnose stroke symptoms sooner, because the faster you are able to do that, the faster you're able to get someone into an emergency room and get that level of care. The other side of the coin is, once you have the stroke identified, once you've been treated, the fact of the matter is you still need to go through rehabilitative services, physical and occupational therapy. And this is another situation where you may not have to stay in the hospital or go to a rehab facility. There's now telemedicine capabilities where you can do this kind of work online. You can actually join both a group as well as individual therapy sessions with a trained therapist. And this is being done at the University of Delaware here, where you can get that kind of physical therapy, talking to somebody, you know, on a video screen. And that's the really exciting thing about telemedicine and telehealth, where we're really going to be able to do a lot more without somebody either A, waiting till the very, very end and getting that kind of treatment, or B, being able to leave the hospital sooner, not necessarily have to go into a skilled nursing facility or rehab hospital, be able to stay home and still get the therapy that they need to expand their ability to recover fully from a stroke. So there's so many exciting things going on in the realm of stroke therapy, stroke treatment. But at the end of the day, prevention is still key. And that's the AHA and the American Stroke Association are organizations that we just need to continue supporting, so we can do both sides of that in terms of both prevention as well as diagnosis and then treatment. So on behalf of everybody here at BB Healthcare, I hope you stay safe, and let's all enjoy where we are today and look forward to a time where we can walk together to support AHA and ASA. David, back to you.
Thank you so much, Dr. Tam. That was great information. We really value your expertise on stroke prevention and treatment. We are really fortunate to have you leading the way on stroke care here in Delaware. And thanks to your support and BB's support, we look forward to our first ever stroke conference here in Delaware in May of 2022. Okay, now let's rally around everything that we've heard so far. While we know that the COVID-19 variants are challenging for all of us, our Heart Walk is creating a sense of community, and that community is now stronger than ever. To further build our community, so we have more survivors like Kayla and those that we all know out there, we need all of you. Today, as we rally around together for our Heart Walk, as we are raising crucial dollars needed to fund the life-saving research breakthroughs and scientific discoveries like what Dr. Tam just described, we have set a statewide goal today to recruit 500 more participants for our 2 Heart Walk events. That's right, 500 individuals who can join us as participants or donors. We already have a phenomenal base of supporters, like everyone here on this call today, registered for our Heart Walk events. However, on our rally day, it's our time to accelerate that walker recruitment for our life-saving cause. Support and engagement from all of you and all of those who will join us on our rally day will help further the American Heart and Stroke Association's mission, including investing in scientific research on COVID-19's effect on the heart and brain health, providing information to those immediately affected by the virus, and helping those healthcare heroes and first responders who are on the front lines caring for patients and searching for cures. Here is where we need your help. You are our most dedicated Heart Walk supporters, and we are asking you to set a goal to register your friends, family, and colleagues as participants and/or supporters today. We are also going to have some fun awards for you that you'll receive around registering folks and fundraising as a result of Rally Day. Before we wrap up today, I do want to introduce you, everyone, to 2 of our greatest champions and supporters, Judy Smith and Erica Rust. Judy has been one of our amazing company leaders at Christianacare for 6 years now. Erica is one of our wonderful company leaders at Bay Health. Christianacare and Bay Health were our top 2 companies in fundraising revenue last year. Judy and Erica really set the standard when it comes to excellence in mobilizing efforts for the Heart Walk. Welcome, Erica and Judy. Thanks for joining us today.
Morning.
Good morning. So, Erica, last year at Bay Health, even with the pandemic, Bay Health employees formed 34 teams and 248 participants and raised over $26,000. And the year before, in 2019, Bay Health raised over $35,000. That's amazing results. How'd you guys do it?
Yeah, so Bay Health employees really look forward to the Heart Walk all year long. It's an immense health-wide system effort, and departments work really hard to mobilize their teams and get really, really creative with fundraising. Today, we have our Heart Walk rally at Bay Health, where we are incentivizing anyone who registers to walk today with a gift incentive. So incentives are the big ticket here.
That's awesome. And then that's amazing. You're doing the rally day today too. I can't wait to see how it turns out. So tell me, like, you guys with raising so much for the American Heart and Stroke Association's mission, like, what are some ways that you guys have done that historically or are doing it this year?
Yeah, so our Bay Health commemorative t-shirts are one of our biggest fundraisers. For $25, employees, families, and friends have an opportunity to receive a t-shirt. And the employees will save these t-shirts throughout the years as a remembrance of that special Heart Walk Day. Matter of fact, I'm wearing last year's shirt today, just for today. So I myself wear them all the time. So
that's awesome. And then I know the one thing that I love that you guys do are these gift basket auctions that sort of like so unbelievable. Could you tell all of our guests today a little bit about that?
Yeah, so our gift baskets, each department will put together a themed basket with the department members contributing to that basket. Then we showcase the baskets at the cafeterias at both the Kent and Sussex campus. So prior to COVID, anybody that walked through when we had visitors could donate. The past couple of years, unfortunately, we just have our employees who were able to. However, this year we are encouraging our team members, our coaches, to post them on Facebook, through Workplace, and we're having an online raffle so that everybody in the community can also vote with the opportunity to donate and fundraise for this event. Last year, we had a little Christmas tree that had $500 in gift cards as ornaments. We also had an iPad in one of them. So they really do get creative with their baskets, and it's really fun to see what they come up with.
My favorite one was the roses. There was a bouquet of roses of dollar bills. Somebody took $500 bills and origamied them into little roses and made like a bouquet of money. It was amazing. I think it was unbelievable.
Yeah.
So Judy, last year, I'm going to pick on you now. Last year, Christianacare formed 40 teams and had 332 participants and raised over $40,700. That is phenomenal.
Thanks, Dave. Yeah, we were very pleasantly surprised at how well last year went. And yeah, in 2019, before COVID, we had 763 walkers and raised over $57,000. So the Heart Walk is our way to come together to fight heart disease, the #1 cause of death and the #5 cause of death, stroke, and to create a sense of camaraderie and goodwill throughout the health system. It's a united effort that our employees love, and truly every year we're all honored to be a part of such an incredible community event. At Christiana Care, we give t-shirts to all registered walkers, no donation required. We want to encourage our employees to come out for a day of heart health education, fun, and physical activity.
That is amazing. I love seeing the sea of the Christiana Care community that's out there. It's amazing. So how do you encourage walkers to support the Heart Walk?
So most of our walkers do peer-to-peer fundraising, asking friends and family to support their efforts. So the website and the app are so important. We ask them to personalize their webpage, add personal photos, share their personal story, share their why, if they're walking in memory of a loved one, etc.
Yeah, and you know, here at the American Heart Association nationwide, we found that walkers raise 70% more when they actually personalize those pages. Yeah, it's pretty amazing, right?
Absolutely. And many of our walkers also use the Facebook fundraising. Just connect to the website and do fundraising through Facebook. We also encourage everyone to download the app and scan those checks. It's such an easy way to post those donations directly to your fundraising page without having to mail anything. And you need the app to use the activity tracker for the 30-day challenge leading up to the Heart Walk. So you can see how you're faring against other companies, others in your company. So it's really great for a little spirited competition. And one overall winner for each walk will win a great prize. The Reward Center also has great incentive gifts that create a lot of excitement: t-shirts, hats, other merchandise. And before COVID-19, Christiana Care hosted a celebration event after the walk at the Hilton for our top walkers, top coaches, and the top team, recognizing and awarding them for their amazing work. Incentive gifts from our executives and physicians for contests all throughout the campaign are key too.
Yeah, it's amazing to see what both of your health systems do. Okay, so now for my final question. This one's for both of you guys. The question that is on everybody's mind: which health system is going to raise that trophy this year and raise the most money for the Heart Walks?
Christiana Care.
I can't wait to see how it all shakes out. Dr. Tam might want to chime in. He might say BB, but you know, who knows? Thank you both so much. You guys are amazing. Thanks for everything that you're doing for us. Okay, so real quick as we wrap up here, in summary, today, anyone who either recruits 5 walkers for their team, receives 5 donations for their fundraising, or raises or donates a total of $250 will receive this, oh, can you see it? This amazing Heart Walk hat. I have to tell you guys, it's like my favorite hat. I was lucky enough to get one of these. We also will have, or an AHA duffel bag as well for folks too, which is really great. It's awesome. Thank you to all of our attendees here today who have joined us. You know, we hope that you'll be able to join us live either on November 7th in Wilmington or November 21 at the Rehoboth Beach Bandstand. Or there's an option to walk wherever you are, wherever you feel inspired, in your neighborhood, at your place of business, wherever you feel most comfortable. Your fundraising efforts in support of the AHA's mission of, as we've heard, fighting heart disease and stroke are inspiring and uplifting. Your support funds these initiatives that address social inequities and barriers to healthcare. You're making a meaningful difference in our local community right here in Delaware. I want to thank Randy and Dr. Tam and all of you for your support in joining us in this fight. Now let's get out there today and recruit our friends and our family and our colleagues to join us. Remember, everyone who recruits 5 walkers or 5 donors or $250 gets some of these special gifts from us today. Well, thank you all so much for joining us. and fighting this good fight with us. Now let's all get out there and rally our friends, and I'll see you in November, right? Bye, everybody.
It comes and goes. We're out here chasing a feeling. Up high, down low. We go from the floor to the ceiling. We fly, we fall. We get back up and try again. Some do, some don't. Some will, some won't. I wanna feel just a little, just a little, just a little. Put my heart in the middle, in the middle, in the middle. Wanna live just a little, just a little, just a little. Wanna feel just a little, just a little, little bit more, little bit more. Big heart, big plans, big dreams, and we ain't even sleeping. Who can? We can. We dive right into the deep end. You win, you lose. You get back up and try again. Some do, some don't. Some will, some won't. I wanna feel just a little, just a little, just a little. Put my heart in the middle, in the middle, in the middle. Wanna live just a little, just a little, just a little. Wanna feel just a little, just a little, little bit more, little bit more. I want it all, please don't judge me. I want some love and some money. I wanna be at the party, yeah, that's me at the party. Wanna dance with somebody. I wanna feel just a little, just a little, just a little. Put my heart in the middle, in the middle, in the middle. Wanna live just a little, just a little, just a little. Wanna feel just a little, just a little, little bit more, little bit more, a little bit more, little bit more. It comes and goes. We're out here chasing a feeling. Up high, down low. We go from the floor to the ceiling. We fly, we fall. We get back up and try again. Some do, some don't. Some will, some won't. I wanna feel just a little, just a little, just a little. Put my heart in the middle, in the middle, in the middle. Wanna live just a little, just a little, just a little. Wanna feel just a little, just a little, little bit more, little bit more. Big heart, big plans, big dreams, and we ain't even sleeping. Who can? We can. We dive right into the deep end. You win, you lose. You get back up and try again. Some do, some don't. Some will, some won't. I wanna feel just a little, just a little, just a little. Put my heart in the middle, in the middle, in the middle. Wanna live just a little, wanna feel just a little bit more, little bit more. I want it all, please don't judge me. I want some love and some money. I wanna be at the party, yeah, that's me at the